Basically, the plan is that patients who are going into Bruce's Farm as an inpatient, I would be going there weekly to do assessments and also work closely with the consultant psychiatrists when they're needing inpatient detox prior to going to Bruce's Farm. It also adds a tier where once they get discharged from Bruce's Farm, I would work closely with the Bruce's Farm team to see them at the PCC for follow-up care. So it may be that they still are on medication linked with a dependency, because some of these drugs cannot be stopped in 10 weeks. They have to take quite a bit longer to be gradually reduced and stopped. So I would see them on a regular basis at the primary care centre to support them with the counsellors, continue the reductions until we get them completely off the medication. It also means that we can work with them, and I can work with them in terms of if they have any physical medical issues, not just the psychological aspects. Because naturally, folk who have drug and alcohol dependency problems, they often neglect their physical health. So it means that we can also, work with that and deal with the physical health.
So if patients haven't been to Bruce's Farm, can they access this new service through the primary care centre?
That is a service we're developing, and the plan is that we would be able to offer them appointments in the primary care centre so that they keep the confidentiality. And again, working closely with the counsellors at Bruce's Farm, we would do an initial assessment, and then if they're suitable for a community detox, then we would be looking at providing them that and the care they would need, and then they would still be able to work if they're in employment, work in the day-to-day life without having to be an inpatient.
From the short time that you've been in Gibraltar, what would you highlight as one of the biggest problems in terms of substance misuse?
I think certainly alcohol is an issue, and benzodiazepines are an issue in Gib. Stimulants are also an issue. There isn't so much of an obvious issue with opiates or heroin, which is the main drug of misuse in the UK.
Okay, John, tell us how this new service, this new GP service, complements the system that we already have.
Well, it's a very welcome addition, an additional tier to what we do. I have to say, Bruce's Farm and my team, the drug rehabilitation services, have been doing a wonderful job for the last 20 years. But over this time, we realised there's certain gaps in the service that needed to be plugged in terms of providing a continuity and a seamless service. And with Dr. Taylor on the scene, this will help to plug those very essential gaps